Hello, welcome to today's lesson, which is really about trying to help you build your vocabulary. I have these, well, they're more advanced words and phrases, but I think they're also very important because we're going to be talking about hospital and medical vocabulary. So if you go to the hospital, these are some words and phrases you may hear. Or if you're watching a TV show or movie and something is happening at a hospital, again, these are words and phrases that you may come across. And like I said, they are a bit more advanced. So hopefully like all these vocabulary lessons, I just hope that you learn something new today, at least one new word or phrase. Before we jump into it, I want to say hello to everyone. If you are new here, please write to me in the chat or tell me your name in the comments. If you love building your vocabulary, please subscribe and hit that like button. Then I can become your teacher. I always want to build and expand our classroom. I do want to say a quick hello. And I'll give shout outs as we go through the lesson. Vicky, Gustav, welcome. Good to see you. Lali, Yashar, Sleepwalker, Angela, a lot of familiar faces. So the way this is going to work is I'm going to present these words kind of like a quiz. So you'll have the opportunity to write your answers in the chat or write your answers in the comments. I always want you to participate because this is interactive English. I want to make it a little more interactive and have you actually participate in the lesson. So let's go ahead and begin with our first, begin with our first question. And I want to start with some acronyms, okay? So actually, wait a second. Yes, there it is. All right. So the acronym, maybe you can see it here, I've pointed out, is ER. And the way that I'm presenting this to you is this is actually a headline that you would come across in a news article. So in this case, NB, they're talking about, I believe, New Brunswick in Canada. So they're saying NB says primary care expanding to try and relieve ER overcrowding. So if we're talking about the hospital and you hear the two letters, the ER, what does it stand for? What are people referring to when they say ER? That is the first question that I have for you. And the first few of them, there are acronyms like this. And this is something you'll hear, I think, quite often, especially if you're watching a movie or TV show about hospitals. They may mention the ER, all right? So if somebody is talking about the ER, then they are referring to the emergency room. All right, excellent. Great job. Anawat, Yashar, good to see you, Yashar. Lucy and Duty. Let's see who else. I saw some other answers in there. Virginia, excellent. Shaheen, yes. Lali, ER is the emergency room. And I think most of the time people are going to use that acronym. They're going to say ER instead of emergency room. The next one, you guys rock that one. Awesome. The next one is ICU. So again, I'm just trying to show you how these are words and phrases that you will come across. This is another article. It says overwhelming majority of ICU patients in Switzerland unvaccinated. Show the data. Okay, so this is an article referring to the pandemic, the COVID pandemic. So overwhelming majority of ICU patients in Switzerland unvaccinated. Show data. So if we're talking about the ICU, this is another acronym that you would come across, that you're going to hear, talking about hospitals, medicine. What does ICU stand for? Okay, and I feel like I told you these are advanced, but we're starting out a little easier, and we're going to kind of ease our way into this. And the ICU, it stands for, as many of you have pointed out, excellent, The intensive care unit. Intensive care unit is what somebody's referring to when they say ICU. Great job, Vicky, Gustav, Teresa, Isan, Natalia, Angela Sleepwalker, Ava. Perfect. Great. I love it. You guys, everybody's participating. Very nice. So again, if you just happen to be joining us, we are talking about hospital and medical vocabulary. So I think this is really useful useful vocabulary. Not that I hope that anybody ends up in the hospital, but again, this is a part of our lives, and there are also many TV shows and movies that have to deal with hospitals. So the next one, this is the last acronym that I have for you for right now. It's not all acronyms. It says, once again, it's another article heading, Guilfoyle Ambulance offering free EMT classes. So if we're talking about EMT, what does that stand for? All right, EMT. And the picture right there, it's a little bit of a hint. You see, this is a picture of an ambulance. So ambulance offering free EMT classes. So if you meet somebody and they say, well, what do you do for a living? And they say, well, I'm an EMT. Okay, then you'll know, oh, okay, I know what this person does. So if somebody tells you that he or she is an EMT, what that means is that this person is, some of you got it, an emergency medical technician. And again, once again, overwhelmingly, I think people are just going to use those three letters and they'll talk about an EMT. I'm an EMT, I'm an emergency medical technician. So, excellent job. Well, I give the thinking emoji. That means, okay, you're maybe learning some new words. Excellent. Great job, Anawat, Lucy, and Duty. Who else got that? Angela, Vicky, Gustav. Some of you very close. I think emergency medical, but the T at the end is talking about a technician, emergency medical technician. The next one that I have for you. So an EMT, they're going to be in the ambulance. All right, let's follow up on that. Okay, so still let's think about the ambulance. Okay, you just saw a picture of it before. So this one is the meaning, the definition is a healthcare professional whose primary role is to provide advanced emergency medical care for critical and emergent patients who access the emergency medical system. In general, this is also someone who would work in an ambulance. They may be in an ambulance. So there are two different types of people, like positions. You have an EMT, and you also have this person right here that would fit this description. So what is the other word for somebody who may work in an ambulance? All right, that's kind of following up on the previous question. So as many of you correctly pointed out, awesome, you guys know that word. I'm talking about a paramedic. So again, I give you the meaning of paramedic. They're providing that primary role, advanced medical care. So great job, Lolly, Virginia, Cesar, just throwing out some, Al-Razaz, sorry if I mispronounced some names, Shaheen, Yashar, perfect. Vicky, Gustav, that's what I do. Perfect, excellent. So the one thing I want to point out is sometimes if you don't know the difference between a paramedic and EMT, this is what I got from, I think it was like maybe the Mayo Clinic was the source. So what it says is like EMTs can handle most of the basic healthcare procedures like performing CPR and using oxygen on a patient, and paramedics can perform more complex procedures like inserting IVs, administering drugs, and more. So basically, I think paramedics, there's a lot more training involved to become a paramedic. And I believe, I could be wrong, that somebody would, become an EMT and then maybe they study more and then they become a paramedic. But a paramedic has more advanced training. All right. So more easier questions. Okay, yes. I told you this is going to be an advanced, some advanced words and phrases. But again, I think useful vocabulary, you meet people, if somebody says, yeah, I'm an EMT or I'm a paramedic, then okay, I kind of know what they do. Now, here's some pictures. This is something that you may see if you go to a hospital. And my question is just, what is it? What do you call this right here? So it's not just something you would see at a hospital. I mean, you would see them, but even if you just go to a clinic and you visit and go see the doctor, they may be wearing this. And I'm sure whether you know the name or not, I'm sure that you have all seen this when you've gone to see your doctor. So this is just a picture. I just want you to tell me in the chat, in the comments, if you're watching this later, what is this? Okay, so being able to put the name with that image, and you guys rocked it out. Maybe just a few spelling for some of it, but it's a stethoscope. Okay, so the definition, it's a medical instrument for listening to the action of someone's heart or breathing, and they would use a stethoscope. And again, if you're wondering, this is the picture that I want you to put in your mind when you hear stethoscope. Okay. The next one, another picture one that I want you to tell me what it is in English. This right here. What is this? Erlinda, excellent. Stethoscope emoji. Wow, cool. I've actually, I don't think I've ever seen a stethoscope emoji. Very cool. Thanks for sharing. So this right here, it has two names. I'm looking for the more specific name. So I'll go ahead and tell you that some people may call this a stretcher. All right. That is not the word that I'm looking for. Okay. I guess you could say it's a type of stretcher, but more specifically, what would you call this? All right. And as soon as I say that, I know everybody's putting down stretcher, stretcher, stretcher. All right. That's not the answer. Okay. You could say it's a type of stretcher. But I'm looking for a more specific. And when I say more specific, notice how it's designed, okay? It's on wheels. So you have this stretcher on wheels. You would call it what? All right? And I know, now I see some correct answers in there. Anna, Shashank, Vicky, Gustav, Mikamol. Perfect. Yeah, you got it. It's called a gurney. So a gurney is technically like a wheeled stretcher used for transporting patients at a hospital. So this is something, a gurney is something you would see at a hospital. Stretchers could also, like I said, people generally could call this a stretcher, but a stretcher is also one that's more, I think it's flat and like two people would carry it. So for example, if they're thinking about a sporting event, like a football match, and somebody gets really injured and they have to carry that person out, they may carry them out on a stretcher, and two people are holding one person at each end. But this with the wheels, you'd say, is a gurney. But no, that's good. I think a lot of you got that one. That was good. The next one, I want to talk about the difference between these two words down here, diagnosis versus prognosis. So the way I've presented this is like the doctor is telling the patient this. So A, they're saying, looks like you were severely dehydrated. And then B, get plenty of rest and you'll make a full recovery. So my question is, which one is the diagnosis and which one is the prognosis? So A or B. So one of them is the diagnosis, the other one is the prognosis. So I'm really just trying to point out the difference between these two words. Sometimes they may confuse people, mostly because the pronunciation, especially toward the end of the word, is the same. So diagnosis, prognosis. Which one is which, all right? Looks like you were severely dehydrated, and then he says, get plenty of rest and you'll make a full recovery. Okay, so I think many of you guys got this. That's awesome, awesome. Love it. Many people participating in today's lesson. So I'll tell you the answer. The first one, because remember A and B, A is the diagnosis and B would be the prognosis. And I think many of you got that, which is great, because I think these are words that you will use if you're talking to your healthcare physician. You're talking to your doctor. They may talk about the diagnosis and the prognosis. So basically, to sum up the difference, show you the meaning of them, the diagnosis is more identifying a present disease, illness, or problem through examination, and that is the diagnosis. They're telling you what the problem is in general. The prognosis is, well, as it said, I got this from the dictionary, refers to predicting the course of a diagnosed disease, illness, or problem and determining treatment or an outcome. So you could think about it like the simple terms, diagnosis like the problem, and the prognosis, the treatment. Like, what should you do? What do you need to do in order to recover? Okay, diagnosis versus prognosis. Okay, so you guys rock that one. Thank you guys for all those answers. I think a lot of you got that one correct. This one may be a little more challenging, so I'm interested. I'm interested to see how many of you get this one correct, and I think this could be a new word. So we're talking about a separate room in a hospital, typically one allocated to a particular type of patient. What would you call this room? Or I think in a hospital, it may be like it could even be an area. Maybe it's a few rooms, but this one section, this one area, or like I said, a separate room. What would you call it? To give you a little bit of a hint, look at the picture. So you see in this picture, this is a picture of a hospital, but it's very colorful. It's a little soothing, and because of the colors, who is this room for? All right. And that's trying to kind of lead you into the answer. And wow, I think a lot of you got this. Excellent. Sleepwalker, Halem, Manu, very good. Shaheen. So what we're talking about is this separate room is basically referred to as the ward. All right. So a ward is a separate room in a hospital for a particular patient. And you may hear it being used with other words. For example, what I was going for with this picture, you could say this is the children's ward. All right. It's very colorful, and therefore, yeah, it's the children's ward. Or you may hear people talk about the psych ward or something like that. But the separate room, separate area for a particular patient. Then I actually have quite a few words for you this lesson. And I'm trying to present it in different ways as well. But overall, you guys I'm very impressed with some of this these advanced words that you guys know. Maybe they're not too advanced after all. So this is from an article, and basically I've blanked out the word, and I want you to put it in context. What do you think it's talking about? I know it's a little small. I couldn't make it bigger, so I'll read it just in case you can't really see it too well. So it says, it's a misconception to think that when most patients are from the hospital, they are back to normal, said Dr. Milan Han, Chief of Pulmonary and Critical Care Medicine at the University of Michigan Health in Ann Arbor. Okay, so just really I want to focus on the first part of this where I've blanked it out. It's a misconception to think that when most patients are from the hospital, they are back to normal. This is the doctor talking. Which word goes in that blank? All right, when most patients are from the hospital. And I think the word, I'm hoping that from is kind of a bit of a hint. Somebody is from the hospital. It's a collocation that I think it's one that you will hear if people are talking about the hospital. And I can already see that many of you got this one correct. Well done. Kudos to all of you. We're talking about discharged. All right. When somebody is discharged from the hospital. Great job, Vicky Gustav, Lolly, Lucy Doolittle, Youssef, Sleepwalker, Yashar, Virginia, Shawshank, Hidran. You're new here. Excellent. Well, welcome, Hidran. Who else? We got some of you put released. I think released in this context would also fit, fit well. It would also work. But I think discharged is to give you the meaning to tell someone that officially that they can leave or must leave a place or a situation. And I think it's that really word official that captures the meaning of discharge. So somebody may be discharged from the hospital, or maybe they might be discharged from the military. Those are collocations with this verb, if somebody is discharged. The next one, you guys got that one. Excellent. Here is another article headline, and I've blanked out one of the words that I think maybe you guys can get this one. It's pretty recent, from a couple of weeks ago. It's saying that this top agent, Raoula, I'm sure I'm mispronouncing it. I think this is from in Italy. Raoula has checkup. Okay. So top agent has checkup. All right. So the first thing I think you would need to know and understand is, well, what is a checkup? And then what are some words that often go before checkup? So top agent has checkup. To give you a hint, okay, look at this line right here. It's saying Ibra Donnarumma Holland agent denies urgent op report. Okay, so think about the context. All right, this person, the agent, is denying that it was an urgent op report. I'm assuming they're talking about an urgent operation. So the agent is saying, no. It was not an urgent operation. It was a checkup. So hopefully that kind of gives you a little bit more of an indication as to what word I'm talking about. It wasn't urgent. They're saying, no, that's not true. It was just a checkup. All right. And I feel like I've said enough that I should show you the answer. And the word that we're looking for, I saw one answer in there, Sajjad. Excellent, Sajjad. Way to go. We're talking about a routine checkup. So this agent, I guess there were rumors that he had to have an urgent operation, and they're like, no, there's nothing to worry about. It was a routine checkup. There are other words that you can use with a checkup. Somebody could go in for an annual checkup when they go once a year. You could go in for a wellness checkup just to see how you're doing. So there are other, I think, words that would fit in there if you're talking about a checkup. I think the clue was the saying they're denying that it was urgent. It was just routine. I was supposed to go in anyway. But that's good. Those are some good collocations with the word checkup. So routine is like a regular medical examination by your doctor, just to confirm that things are okay and there's nothing wrong with your health. Then we have some more pictures for you. What is this? What do you call this right here? And I guess to make it a little more specific, I'm really thinking about like that tube right there. Okay. So what would you call, well, I should say these, because there are many, there are several, there are 4 of them. But what is that called? This is just a picture, and you thinking, well, what is this vocabulary word? I'm talking about this thing, so it is a noun. Okay. And I told you, like, really referring to that tube. So Wow, you guys know this vocabulary. Okay, excellent. Anawat, sleepwalker. Uh, where is it? Ava, Talal, Sid, Roaz. So, referring to a syringe. Okay, so the meaning of a syringe, you can see the picture right here. And it's really, like I said, the tube is an important part. The way the dictionary defines it is a hollow cylinder-shaped piece of equipment used for sucking liquid out of something or pushing liquid into something, especially one with a needle that can be put under the skin. Okay, so that tube, like a syringe. Excellent. Then we have this right here at a hospital or even a doctor's office. People might, patients may have to wear this, and they put this on, and it is called a what? what would you what would you call this? Recently, I had I just got a mole removed. This was several months ago, but yeah, I put this on right here. So what do you think? What would you call this that a patient would wear? All right. And I see, excellent, great job. Mohit, Yashar, Sun, well, Sam. The word that I'm looking for is a gown. Okay, this is a robe worn by a patient in a hospital. Some of you had put scrubs in there, which I think, if I'm not a medical professional, but I think the scrubs would be what the nurses or the doctors, that's what they would be wearing. The patients would wear a gown, a hospital gown is what, and typically I think most of the time they are blue, but I imagine not always, but this is what it says for a gown, a robe worn by a patient in a hospital. Very good. So then we have this. I've given you the picture and the meaning. A procedure where a needle inserted directly into a vein to deliver liquids to the blood. What would you call this? And it's, well, I don't want to give it away. We've actually already talked about it in one of the meanings of one of these other words before. But hopefully that picture, what does that person have that's going into their hand right there? And this is the meaning that I found online. The needle's inserted directly into the vein. And I think that's a key word right there, or phrase, into the vein. So the correct answer, and some people, I think you guys got this, the correct answer is an IV. And I saw, yes, Angela, Caesar, Vicky, Gustav, perfect, Sid. And an IV is short for intravenous. And I think what the literal meaning of it is into the vein, intravenous. And they define it as a procedure where a needle is inserted directly into the vein to deliver liquids into the blood. And sometimes you might hear people talking, if they're talking about their experience at the hospital, and they say, yeah, they hooked me up to an IV because they had to get these liquids into their blood. Somebody was hooked up to an IV. All right, so I think a lot of you are familiar with IV, which is good. The next one, this is a drug treatment. So you can see, this person is hooked up to an IV. A drug treatment that most often used to treat cancer by killing fast-growing cells in your body. I've included this because, again, cancer is something that I think all of us, know about. Many are affected by this, whether if it's not directly yourself, but you know someone, a family member, a friend who is dealing with this. So I wanted to include this word, the drug treatment that most often used to treat cancer by killing fast-growing cells. And many of you, it seems like you guys are familiar with this because, again, this is a common treatment that people will talk about, not just in real life, but also in movies, TV shows. It's a pretty common word, I'd say. And like many of you said, we're talking about chemotherapy. So the drug treatment, specifically, it uses powerful chemicals to kill fast-growing cells in the body. Chemotherapy is most often used to treat cancer, since cancer cells grow and multiply much more quickly than most cells in the body. All right. Then we have, like, following up on chemotherapy and talking a little bit about cancer, I have another where I'm blocking out two words, and they're both adjectives, and they're somewhat opposites, I'd say. So there's two parts, A and B. I'll read the paragraph in case you're having trouble seeing it. I know it's very small, but it says, brain tumors can invade or spread, metastasize, into healthy brain tissue and rarely to distant organs within the body. Brain tumors do not invade nearby tissues or spread to other parts of the body. So in this case, we're talking about a brain tumor. So the first part, brain tumors can invade or spread. The next part is saying the brain tumors do not invade nearby tissues. So A is one adjective that you may hear people talk about, and B is another one. And I included this with, like, talking about brain tumors. Again, this is another article that I found online, and just block those out. You may hear people use these words when referring to brain tumors. So I think, again, like, it seems like a lot of you are familiar with some of these words. You guys are getting a lot of them correct. It's great. Like I said, I think it's great and very important vocabulary to know. And I try to teach you new vocabulary as often as I can related to a topic, so that we can stay on the same topic. So let me show you the answers. Whoops. Let me move myself over. Okay. So it's saying the first one, A, is talking about malignant. Malignant brain tumors can invade or spread. And then the next one that's saying they don't invade would be benign. So it's really talking about the difference between malignant and benign. And to give you the meaning and show you them to you right here, once again, there. Malignant means likely to grow and spread in a rapid and uncontrolled way that can cause death. So basically, a malignant tumor is cancerous. So if you're referring to a tumor and they say it's malignant, that would be cancerous. If it's benign, then it means like mild type or character that does not threaten health or life. So specifically talking about a tumor, it's not always cancerous, but if it's malignant, then it would be cancerous. If it's benign, then no. So these, again, I think are two useful and important adjectives to learn when you think about hospitals or health or treatment or medicine. So these are kind of bringing it back around. These are all of the words that we went over today's lesson for those of you who are. And what I want to say is that I think that, like I said, not only is this useful, but these are words that you are going to come across, probably likely to come across in just your daily life. All right. So the next thing I did want to say, I hope you guys enjoyed the lesson. If you do, if you like what we do, I'm going to post these for the patrons and members. If you like what we do and want to show a little love, support, you can join, get a YouTube membership, Patreon. Saw a lot of members and patrons today, Lali, Vicky, Gustav, Takayo. Always appreciate the support. Thank you guys so much for joining me. Again, my goal is that I hope that you guys learn something new, a new word, a new phrase that you can take with you and hopefully put up here in your active memory. So thank you guys for participating. Again, just throw out some quick goodbyes. And Ava, Cesar, Ario, Lali, thanks for joining. Vicky and Gustav. Where is it? Takayo, Yashar, good to see you. Mariano, Aguirre, thank you. Good to see you. Namrata, Eddie, Jane. I think I could go on and on. Today, it was a lot of, I think there was a lot of great participation in today's lesson. And of course, in the future, I will come back again with some of these more interactive lessons. So please enjoy the rest of your weekend. If you did like the lesson, hit that like